So same substance, a lot of different perspectives of them represented by these different names. Now I'm going to give you a bit of a dive into the classes of medicines, because there's a whole bundle of medicines that come under the psychedelic, entheogen, hallucinogen label. The first group are and I can never pronounce this well, phenylethylamines. Chief among them are MDMA, which is the medicine which is supposed to be the chief ingredients in the street drug ecstasy or Molly. However, you can't tell what's on the street, and a lot of times it only has some MDMA. MDMA is the ingredient that's being used in the studies for PTSD that are now in the phase 3 trials, and we'll talk about those, which are basically sometime in early 2024. It is extremely likely that the FDA is going to authorize these for use in a certain kind of psychotherapy for PTSD, because the results are stunningly successful. MDA, which is close to MDMA, it also shows up in ecstasy. And mescaline, interestingly, that comes from the peyote buttons, is also in this category, even though these medicines have very different effects. And it's quite risky to talk about the signatures of these different medicines. In other words, what their effects are, because set and setting, which we'll talk about in a bit, which is the mental attitude with which we go into an experience and the environment in which it's taking place, plays such a critical role in what will actually happen. However, that said, MDMA is something of a love drug. It does not create the kind of visual distortions and the kinds of imagery that comes from other more classical psychedelics, but it does give people a radical sense of loving others, feeling loved. And interestingly, I've had many conversations with Bessel van der Kolk, who's done a lot of work on trauma, lifelong, and Bessel will tell you that until seeing MDMA used for PTSD, he had pretty much thought that people who have complex trauma, had poor attachment histories, and then are later exposed to other trauma, like the likelihood of them being able to really feel safe and really feel loved and really feel like they're with Mr. Rogers, like you're okay, sweetheart. The likelihood of that happening was pretty darn small. He now says, nope, don't believe it anymore. People experience this with MDMA. They actually experience what secure attachment feels like. They actually experience what it feels like to be valued, not contingently, but just for being who you are as a human being. So MDMA is quite interesting and different from the other medicines in this regard.